Hi everyone, welcome back to MD-VOD, where today we're joined by fertility specialist Dr. Francisco Arredondo, and we're taking your questions live from Facebook and Twitter. And the first question is a great question, Dr. Arredondo. The perceived costs associated with infertility keep some couples from coming to see you. And I gotta be honest. I've always been worried about the costs of such things. How much does it cost for a couple to come take a look?
Excellent question, because a lot of the patients do have a lot of fears, and one of the fears is cost. So let's break it down in two. One, the diagnosis, to pinpoint what is wrong. The great majority of insurances will cover most of the test of diagnosis. Some of them don't, and it depends on the state. And I will encourage the patients and the viewers to actually go and look in their insurance company, as well as the state laws. In the American Society of Reproductive Medicine website, there is actually a state-by-state disclosure of what are the laws covering each insurance per state, ASRM.org. And for example, the semen analysis, while most of the times is covered, if it is not covered, the price can range from $50 to $150. So it's relatively inexpensive for a test that will pinpoint 35% of the causes of infertility. The blood test to detect the ovulation could be anywhere between $30 to $100. So it's also a very simple and inexpensive test. The hysterosalpingogram, the dye test, the great majority of times is covered by insurance, but if it is not, it can range anywhere between $300 to $600. So you're talking that with less than $1,000, if it is not covered by insurance, you can actually pinpoint 90% of the causes of infertility.
Wow, that's
so
a great
it's relatively inexpensive to at least find out why you're not getting pregnant.
Wow.
When it comes to the treatment, certainly the prices change, but again, check with your insurance. For example, in Texas, where I practice, approximately 15% of the insurances will cover even in vitro fertilization. In certain states, it's mandatory for the insurances to cover in vitro fertilization. Massachusetts, Rhode Island, and other states have mandatory laws that makes the in vitro fertilization very accessible. But in case it is not covered, we talked about intrauterine insemination, IUI, and depending on which medication you use, the cost range anywhere between $800 to $1,500, $1,600 per cycle. When you talk about in vitro fertilization, which is the one that will give you much more pregnancy rate, the pregnancies can range, depending on the area, depending on the center, anywhere between 8,000 to 16,000, sometimes even more per cycle. If you would like to do the comprehensive chromosome screening to identify those embryos with chromosomal errors, that may increase the cost another $4,000 to $5,000. So yeah, cost is an issue, and it will be something that we as a industry and as a scientific field, we need to work in order to make it more accessible for other couples.
So the cost, again, just to summarize, it's not really that expensive to make the diagnosis. Those three tests you could do, if you have no insurance, you could do it for roughly $1,000. Is that right? I mean, it's not nothing, but it's definitely not what I thought it was.
At least.
Is there anything coming down the road that you think will make fertilization more affordable for couples?
I think that the more we advance in the laboratory to identify the right embryo, and we're doing it, but it's basically only like 7-8 centers that are capable of doing that comprehensive chromosomal screening. But as this become much more prevalent, I think that will increase the pregnancy rate, and we will probably make it more affordable whenever also the medications become more inexpensive, which is the other limiting factor. That's one side of the story. The other one, it is as we, as a society, the women delay childbearing for professional reasons, etc. There is a little bit more of pursuing the fertility later on in life. So making more affordable egg freezing in order to postpone the fertility later on. That is another breakthrough technology that will help us extend the period of fertility for certain couples.
That's a great point. So extending the fertility sort of timeline, how long, let's say a couple decides they're not quite ready, but they want to preserve their ova. How long can you freeze an egg or an embryo? Can you actually freeze?
For years, several years. I believe that the embryo that has survived and has been actually given a child, I believe the longest one has been more than a couple of decades. So 15, 20 years. I am not positive, but we keep it for years, and there is absolutely no risk of damaging because of the years.
Another question up is age. Does increasing age increase or decrease the chance of having twins?
Well, in infertility treatment, it doesn't really alter too much the chances. We know that age is correlated with success. The less young a person is, the less young a woman is, the more likely that she's going to have challenges to have a successful pregnancy rate. To give you an example, at 25 years of age, from 100 couples that attempt to get pregnant this month, 25 will get pregnant. So it's a relatively inefficient system because it's 25% at 25 years of age.
Wow.
When you reach 40, that drops to 4 or 5%.
Wow.
At 35, actually, you are on the realm of 10% per month. So there is a significant decrease, and this is related to the age of women, because women are born with the total amount of eggs that they will ever have. Actually, they are born with approximately 2 to 3 million eggs, and they never produce any more. Okay? By the time they have their first period, they've lost 1.6 million. They have 400,000, and every month there is a constant loss of eggs, and approximately at 35 there's a sharp decrease in fertility, but constantly you're losing eggs.
Wow, that's a great point. I want to thank you so much.
Oh, it is my pleasure.
Dr. Arredondo, for joining us.
Thank you.
I got to reiterate that point. 25% of 25-year-olds, right, will be successful getting pregnant.
Per month.
4% of 40-year-olds. And I like how you said it, the less young you are, not the older you are, the less young you are.
Less young. Nobody.
I love it.
In my office, nobody is how old are you, is how young are you.
I love it. Hey, thank you so much. If you missed any of our show today, please go to emPOWERme.tv, MD-VOD. Our fertility expert today was Dr. Francisco Arredondo. We'll see you guys next time. And now, for any episodes you might have missed, they're available at the emPOWERme.tv website and the YouTube channel. And be sure to leave us any comments and questions so that we can better help you deal with your disease. We'll see you next time on MD-VOD.